So there was a very wise man who wrote in a book several decades ago this phrase that I've pulled out. His name was Michael Lerner in Choices in Healing in 1994. And he said that cancer is not always experienced as the greatest problem facing a person with cancer. And so I'd like to take that theme to explore some of the questions that I've just laid out. What then is the greatest problem that people with cancer are facing? I think one of the things that cancer does that, although not unique only to cancer, is one of the more prominent things that occurs when a person hears the word and is diagnosed with cancer. Cancer intensifies the experience of life by facing people with the clear possibility of suffering and death, which, under other circumstances, is something we all normally ignore. We all are faced with a very short period of time in life, and we all experience pain, suffering, death, and disease of some type. But most of the time we go about our day and it doesn't disrupt or interfere with how we think or function. But when the diagnosis of cancer occurs, suddenly it's in our face. And suddenly the intensification of that time trajectory, the amplification of it occurs. This provides us with an opportunity that really very few other illnesses or events do. And that is the opportunity to decide on how to respond. One way to respond to that is out of fear of the future and all the activities that go with that, such as creating a war to destroy that experience. Another opportunity, however, would be to learn how to live now, in love and joy, appreciating the fact that we are not experiencing suffering and death now, and that every moment is precious. I dare say that the first response is the one that most people react with, and that our industry and the cancer, collectively, the cancer response has been producing. And this, I think, is creating perhaps the greatest problem with the diagnosis in cancer. People living with cancer and the teams who treat them, they often speak in two completely different languages. One speaks of the war on cancer, on killing the cell, and the other one talks about the need to heal, to be whole, to have a reduction in suffering, and if they have to die, a peaceful death. If the cancer is gone, but without prolonging life or allowing the person to live with a high quality of life or as normally as they can, then I would suggest the treatment may not be achieving the person's goals. And therefore, it should not necessarily be the only thing that we focus on. And these are actually two other quotes by a veteran, a VA, Veterans Administration oncologist, and a leader in the Integrative Oncology Leadership Collaborative that I'll mention and talk about in a minute, by the name of Alyssa McManaman.